Hey everyone, my name is Brittany Sievers, and this is my case presentation and intervention summative assignment for Counseling 613, Counseling Children. My topic for this presentation is children of parents who use alcohol or other drugs. My main focus for this case will be the use of alcohol, and some of the relevant sources and citations that I found were through AAMFT, which is American Association for Marriage and Family Therapy. I found an article from American Addiction Center's Children of Alcoholics, the Impacts of Alcoholics on Kids, the NACOA, which is the National Association for Children of Alcoholics, and the NIAAA, National Institute on Alcohol Abuse and Alcoholism, and I found many other sources and citations of papers that I will include in my references at the end. For the case study, we are using an individual with the initials AJ. AJ is a 14-year-old freshman in high school. He is a Caucasian male living with his parents in rural Pennsylvania. AJ is an only child. He came to see a counselor because his mother wanted him to, quote-unquote, talk to someone. AJ's mom was concerned with his grades dropping significantly and mentioned that AJ seems to be more avoidant. She claims AJ will come home directly from school and lock himself in his room, and he plays video games or listens to loud music. During the initial screening with a counselor, AJ mentioned that his dad abuses alcohol, drinking more than 5 days a week. AJ said his dad will drive to the bar directly after work and come home late at night. He says that his parents, quote-unquote, fight and argue a lot, and he doesn't want to be around them when they argue. AJ describes feeling empty inside and angry at his parents. AJ's dad used to help him practice baseball, but has stopped because he is too focused on, quote-unquote, getting drunk. AJ mentioned feeling sad and lonely. He blames himself for his dad's drinking, saying that maybe I am too much for him, maybe I'm too much to handle, maybe I ask for too much. AJ does not like to spend time with his friends at their house because he said his friends have a quote-unquote perfect life with a perfect family. When AJ comes home, it is not a happy home environment like it used to be. For this case study of AJ, the main symptoms I would like to focus on are his hyper-responsibility. AJ feels responsible for things that are beyond his control, such as his dad's drinking habits. He tends to blame himself for the reasons why his dad drinks too much. AJ is guarded in his personal communications. He has begun to isolate himself, and he is not socially interactive with his peers as much. He lost his interest in his favorite sport of baseball because his dad is not interacting with him anymore. AJ feels a level of disconnection with his family, and he holds on to a lot of anger, especially toward his father. AJ has a lack of self-esteem and wishes his family were different. Now we can begin to conceptualize the problem situation. The most important presenting issues are that AJ is isolating himself and avoiding his friends and family. Second, AJ experiences anxiety at home when his parents are fighting. And AJ is angry with his dad for abusing alcohol and spending less time with him and his family. Some of the counseling goals for AJ would include to decrease his level of anger and anxiety, to enhance AJ's effectiveness and ability to cope with the problem, to help AJ and his family understand alcohol addiction and seek help starting with family therapy, and to increase social interaction by attending group counseling with other adolescents who are affected by alcohol or other substance abuse. To conceptualize the case from a theoretical lens, I looked into 3 different kinds of therapy that I think would be effective for AJ and his family. Those 3 forms of therapy are CBT, family, and group therapy. Cognitive behavioral therapy, otherwise known as CBT, is a type of psychotherapy that focuses on making connections between thoughts, behavior, and feelings. Next, family therapy focuses on helping the family function in more positive and constructive ways by exploring patterns of communication and providing support and education. And group therapy is a form of psychotherapy that uses the power of group dynamics and peer interactions to increase understanding of mental illness and/or to improve social skills. All 3 forms of this therapy I think would be effective in working with the case of AJ and his family. To go further into the theoretical lens conceptualization, first I'll focus on CBT. I think using CBT with AJ can help change his negative thinking patterns. When AJ tells himself, "I am too much to handle, I ask for too much," it makes him think that he is the reason why his dad drinks too much because he is too much to handle. This is a cognitive distortion for AJ. And in turn, AJ's behavior is to isolate himself from his friends and his family. Using CBT interventions can help confront and modify this distorted belief. CBT is meant to be short-term, and only a handful of sessions are needed to be effective in therapy. CBT is problem-focused, so the problem is addressed and dealt with in the present moment. CBT helps change negative thought patterns, identify positive responses to stress, improve communications with others, and help to improve self-esteem, as for many others. In an article that I read from the American Association for Marriage and Family Therapy, alcoholism affects individuals physically and emotionally in the way they behave, think, and feel. It can also affect family members in these ways too. Alcohol may be the central guiding principle of family life, causing trauma in shaping or restricting each individual's development, yet family members will work hard to hide this secret. Addiction has the power to destroy a family. Families often try to deny the problem, fearing the family will fall apart if the problem is faced. Alcoholism can cause pain and confusion that spreads, entangling friends and family in a web of explanation and denial. This is where family therapy comes in order to have an effective treatment for AJ and his family, including his mom and his dad. So the components of family therapy include 3 main goals, and that is to improve communication, solve family problems, and create better functioning in the home environment. Other goals of family therapy are to explore interactional dynamics of the family, mobilize the family's internal strength and functional resources, restructure the maladaptive interactional family styles, and to strengthen the family's problem-solving behavior. Family therapy involves education, counseling, and coping skills. It begins with psychoeducation of the problem situation. Family therapy helps to reduce distress and conflict by improving the systems of interactions between family members. For the case of AJ, it is very important to involve psychoeducation, counseling techniques, and coping skills with the entire family. Family therapy for the case of AJ will include AJ, his mom, and his dad. Psychoeducation is an important component of family therapy, especially if there is alcohol use involved. AJ is 14 years old, and he's just beginning high school, and he's having these cognitive distortions as if his father's choices and his drinking habits are AJ's fault, when they are not. It is important to discuss addiction and alcohol use with the entire family and explain to AJ that his father's choices and his drinking habits are not his fault. That would be the very first place to start. And then the counseling techniques and working with coping skills with the rest of the family will follow. For the specific intervention process, I will be using family therapy and CBT components. So the overall counseling goal for AJ and his family would be to improve the family relationship, which will include AJ, his mom, and his dad, and resolve family conflict and dysfunction, which the main focus is the dad's alcohol use. The detailed steps include building rapport and giving psychoeducation about addiction with the family. As a counselor, I would use the 7 C's, which is pictured to the right, created by Jerry Moe. The 7 C's are: I didn't cause it, I can't control it, I can't cure it, but I can help take care of myself by communicating my feelings, making healthy choices, and celebrating me. I think this is a really nice tool in working with addiction in families to give psychoeducation about it's nobody's fault, nobody caused this is a family disease that affects all of them. And also, in my references, I will include the NACOA's article about understanding abstinence, sobriety, and recovery. This would be a great psychoeducation tool to use with the family. Next, I would work through communication techniques, specifically using I statements, so that AJ and his other family members do not blame one another. The use of I statements is a CBT technique to take responsibility for one's own feelings and describing a problem. For example, AJ can say to his father, "You never play baseball with me anymore. I guess you don't want to be around me or interact with me." But an I statement would be reframing that sentence to say, "I feel really hurt when you don't play baseball with me. I am afraid that you do not care about me anymore." This I statement switches the tone as to focusing on a feeling rather than placing blame on an individual. Lastly, I would use open emotional expression with this family to reframe anger, pain, and other strong emotions and gain deeper awareness to resume a healthy family function. It's important in family therapy to give the opportunity for each family member to explain their side of the story or express their emotions and feelings that are happening. And as far as CBT, also like dealing with emotional regulation can help reduce symptoms of depression and anxiety. So overall, these are the main interventions and techniques that I would use with AJ and his family to address the dad's alcohol abuse and working towards recovery and better communication with the family. As for evaluating success, in order to measure if the plan is working or not, I think formal assessments are a great tool. Being that AJ is 14 years old, his reading levels are more competent than giving a formal written assessment to, say, a 6-year-old, as well as his family members. The desired outcome would be the dad's recovery and abstinence from alcohol, and overall for all of them to have a healthier family function. And whether or not to know if